licensed marriage and family therapist.
Hi, my name is Darcy Easley, and I'm a licensed marriage and family therapist.
Hi, my name is Lucy Guadalupe, and I'm a licensed associate marriage and family therapist.
Hi, my name is Adia Williams, and I'm a licensed associate marriage and family therapist.
And you're listening to Mental Breakdown.
About therapy myths that we either hear like on social media from clients, friends, and family. So I have a list. I can give you like my favorite ones if you guys want to hear them, or we can just kind of go around, whatever you guys think.
Yeah, let's start with some of the ones that you have.
Okay, my favorite one is ChatGPT can be my therapist.
That's a good one.
What do you guys think about that one?
I think lots of people use that.
Yeah.
And it's really interesting how well it gets to know someone.
Yeah.
Which I think is interesting, but then, then you go a little further and you're deeply concerned about the idea of taking really significant advice from something that doesn't exist.
Yeah. I mean, my concern is like, I feel like people will chat GPT their symptoms and be like, what do I have? And then, and chat GPT, I think, is a learning AI model. And so anybody that's listening to this later might be like, oh my God, that's the dumbest thing ever. It's not a learning AI model. But like, it's not learning how to diagnose like we did in school, with training, with continuing ed, with supervision, with all of that. So it makes me wonder how many misdiagnoses is it giving?
For sure. Well, and just like there's so many nuanced things. And my understanding of it too is it's like an echo chamber. So like it's only putting out what you're putting into it.
Yeah. So
if you're leaving out pieces of information, that's just completely missed. Whereas like actually having a therapist, sometimes therapists can pick up on things that maybe the client's like not originally seeing or doesn't realize about themselves.
Yeah. Well, and think of how many times we've sat in session with somebody and our guts telling us, oh, this feels like trauma or this feels like depression. Even though the client isn't putting that into words, it's like our intuitive kind of training is picking up on it. And ChatGPT isn't going to do that.
And it eliminates, I think a lot of the things that we tend to do in session is observe behaviors. And so there may be things that are going on with the client that they're not even noticing in themselves.
Yeah.
That we're able to observe when we have a client in front of us in session.
Yeah. What were you going to say, Lucy? I feel like I interrupted you.
No, you didn't. I also just think using the internet as a tool is dangerous. I think people will, even just aside from ChatGPT, just using the internet as a way to kind of therapize themselves, whether that means they're just looking up information or they're trying to self-diagnose or they're, taking content from social media and social media creators. And, I think that's something that scares me even more than ChatGPT is people who follow an influencer who either isn't even an actual therapist, but they talk about things like mental health and trauma, right? And people just kind of run with it. You think about the amount of people that come into therapy and they're like, I have this attachment style. And it's like, where'd you learn that from, right? And they're like, well, this person, I saw this video on Instagram and it resonated with me. And I feel like that's exactly how I am, right? And then they kind of put themselves into potentially this category or this bubble that maybe they don't actually fit into, but just because maybe one or two things that this person said resonated with them, now they're running with that.
Yeah.
Yeah.
And I think there could be good information that's out there. I think,
totally.
Especially with social media, I feel like social media has destigmatized mental health and trauma, depression, things like that. But you're right. I mean, we have clients that are following influencers and it's like, well, I have this because they describe this and we're the same. And it's like, okay, but you're really not. And,
right.
I'm even thinking of depression. Depression can manifest so differently from kids to adolescents to males to females, and so it's those intricate little things that we're observing, we're reflecting, we're asking about and assessing that they're not going to get either from ChatGPT or social media.
Mm-hmm.
Yeah. I do think ChatGPT can be good to help people like formulate words, or, you know, how do I say this in a way that I don't sound like a dick, or I don't sound, you know, insensitive. But I always tell people, like, don't rely on it to do that. Like, part of it is we still need to be able to use our own emotional intelligence. Like, that can be a good kind of like skeleton of what we're going to do, but then put yourself into it.
I also think one thing that also comes to my mind is it's not, I think people really trust it. Everything, like if ChatGPT said it, it must be true.
Mm-hmm.
I mean, correct me if I'm wrong, but didn't the creator of ChatGPT literally post something about he's like shocked that people trust it so blindly? Like, it's still something that can be flawed. Like, it's still a system that can have mistakes. And I mean, the symptoms thing, that's like really serious, right? Like medication advice, you know, I don't know that, like, I don't know if this is completely true, but I did see something where like somebody got advice to like stop medication, just cold turkey.
I saw that too.
And they had like horrible symptoms, all this stuff come up. Like, those kinds of things really scare me. And of course, like, to your point, there's helpful information out there. There's like ways you can use it to be beneficial. But I think like crossing that line into this has become like my companion, or this has become my like number one source of information gets scary.
For sure. Do you guys have clients in session that like pull up ChatGPT while you're talking to them, or like show you things?
I do, for sure.
I don't. Really lucky. I don't have that happen.
So I have a friend that's an attorney, and like she's had clients like pull up ChatGPT and like consultations. It's like, well, ChatGPT said this, and so I'm just curious if that's happened.
Sure.
Yeah, I haven't really had anyone specifically do that, but I do have people look up symptoms of things like OCD or PTSD or whatever it may be, and kind of like share the information that they have gathered from it. And some of it's accurate, some of it's not, some of it's not fitting to them. And they will, that's like where the self-diagnosing comes in. So I have more of that, but I guess that's still ChatGPT. I'm sure that's what's coming up when they're looking it up.
Right.
I have had clients say, like, I, you know, put this into ChatGPT and it gave me this. What are your thoughts on it? And I've had conversations with clients too about like just kind of checking those things. Like, double check your information. Don't just believe the first thing that you read from ChatGPT.
I feel like when I was in grad school, I remember doing the like abnormal psychology class. So it was like abnormal psych and psychopharm. And I remember my instructor being like, don't research yourself in the DSM because you're going to think that you have every single diagnosis possible. And that's what I feel like we're saying right now with like ChatGPT or social media or the internet or anything like that. It's like, you know, use it maybe as a starting point, gather information, but don't take it as facts.
Yeah, that's so true. And I feel like there's like this line between, absolutely, I think, Minon, you were saying this. I think social media has destigmatized mental health, and like therapy can help a lot. And even just like talking, having like a conversation started about some of these things, which is huge. That's like a huge positive.
Yeah.
And I feel like the way social media has trends and like fads, sometimes a topic, like, I don't know if you guys have seen this, but I feel like there is like phases of things. Like, now everybody's a narcissist, or like now everybody's diagnosing themselves as autistic, or now every single person has ADHD, or now every single person has BPD. Like, I've seen that a lot, like on the internet, people self-diagnosing these kind of like, I don't want to call it like a fad because it's like absolutely like a serious thing, but it's almost like it comes up. There's like seasons for certain disorders. Do you guys notice that?
Yeah. And that was happening even before social media. I mean, Darcy, like we saw that where it's like psychiatrists were like, everybody has, you know, bipolar. Like at one point, like that was the trend. And so I do feel like some of that is like now carrying on to social media, and it's a bigger platform because like we would see it like when we were, you know, back in our agency days before private practice, because we worked like every job as a therapist that we could, you know, we would have psychiatrists that it's like, oh, like this guy is going to diagnose everybody with this. Like that's the theme. You know, and yeah, like I'm thinking when I worked at Park Place and there was one doctor, like every single client had the same diagnosis. And I'm like, I don't know how to argue with you because you are a doctor, but you're wrong. So there's that. I do think, I guess I have a couple thoughts about Adia, what you said. Like, I think my question is, are more people being diagnosed with it because we're talking about it? There's more awareness, I guess, one. And then two, you know, I think it's great for people to hear about some of these different things so that they can get information. But again, it's like, don't take it as facts. Like, talk to a therapist, talk to a doctor, talk to somebody to get more information so that we can do that intricate, like, assessing and diagnosing. So there was all my thoughts that I just vomited on you guys.
I feel like both of those are true. Like, I think for sure there's more people talking about it and more people getting diagnosis and like more people going to therapy and like going to the doctor because it's less stigmatized to go see somebody and ask for help. I think like I was talking more about people on the internet who don't go get a professional diagnosis, but rather
just
they're
diagnose themselves.
Yeah, like kind of what Lucy was saying, like, oh, like a couple of these things fit or these things resonate with me in this video. And so like,
that must be me.
I feel overstimulated in public, like I must be autistic. And it's like, whoa, well, there's like a lot of other things that could be happening here.
I mean, I'm pretty sure I've sent videos like that to Darcy that I'm like, is this me?
I always respond and say no. But I think that that's the thing. Like, it's like social media already causes people enough anxiety. Yeah. So I worry about people not considering, like, what happens if you put something into ChatGPT and it says, this is what you have, quote unquote, and the amount of stress and anxiety a person may feel when you're sitting in your home reading that on your phone or on your computer, and then you have no idea what to do next. And I think off of what Adia said, like that's the biggest concern is like if someone's going to use that and then not follow up or not get any or not figure out what they need to do to kind of manage what's going on, then I worry about what happens to those people who are just sitting at home stirring in those negative thoughts about themselves.
For sure. What would you guys say to them? Assuming they're listening right now.
I think
my gut would be don't do it. Or if you, I mean, I think that there's a healthy way to use things. I think everybody can use the internet to kind of look at things and say, okay, maybe there's this potential. But I think that we all have to remember that there are professionals for a reason, right? Like people go to school and people learn these things to be able to provide a service so that people can feel supported and get the help that they need. And last I checked, ChatGPT doesn't have a degree. So, like, those are the things that I try to remind people of. Like, it can be a tool for you to kind of gather information, but you shouldn't use it as a tool to make serious life decisions.
Yeah, totally agree with all of that. I would say, like, for the people who've taken that step already and maybe are, like, at home sitting in that anxiety, one thing I feel like I tell clients a lot if they're like, I kind of feel like this or I kind of feel like this, is like, let's talk about that. Let's have a conversation about that. Or like, let's follow up with a psychiatrist or go to the doctor and get like a baseline of these things. Like, there's no harm in getting an actual evaluation done if you seriously think you have ADHD or something like autism or, you know, whatever it is, OCD. So it's like, if you have that real concern and you're stewing in it, like, do something different. Like, let's have an actual conversation about that with somebody.
And Darcy does a lot of those evaluations. So like autism, neurodiversity, like all of that stuff. And you're right. Like, there's no harm in getting an assessment done to see, okay, what actually is this? And then what do I do with it? Because it doesn't mean that clients have to then go on medication. And that was another thing that I wrote down is I think clients avoid therapy because they're worried that we're going to like prescribe them medication or push them into taking medication. And like, well, I don't want to do that because I don't want to take meds, so I'm not going to do therapy. And it's like, okay, well, one, we don't push that and we can't prescribe. But with the assessment and the diagnosis, it's like, okay, but now we have a starting point of, okay, what tools and interventions can we use? And for some people, that might be medication. But we let clients make that decision.
I think I would even just encourage people to get curious with themselves as to why they're even, like, what is the role? Why are you even looking it up in the first place? Because is it because this is something that you're really struggling with and it's impacting your day-to-day life and your day-to-day functioning? Is it more of just like a curiosity? Do you display one of the 10 symptoms? Do you display all 10 symptoms? You know, and like just kind of figuring out like, what are you just curious about it? Just kind of getting curious with yourself, like why you're even looking into it in the first place. Is it like is it something that's really severe, or is it just a curiosity?
Because I think that that's part of the concern, Lucy, is like when people say, well, I needed to know what was wrong with me. And so I think that that's a common kind of statement that I hear. And so I always have to respond with, well, there's nothing wrong with you. And so that's always my immediate response. But I think that that's the other thing I think that's concerning, is that I think we as a society look for a label to kind of describe everything. And not everything has to have a label.
Yeah.
Well, I feel like on that just made me think about one of the things I feel like as therapists, we generally believe is like, you're not your label. Like a diagnosis doesn't define you. Like it can be really normalizing for people. Absolutely. I get that. And like, just because you have a diagnosis for something doesn't mean like you have to define yourself as that for the rest of your life. Yeah, I don't know.
Darcy, you do a good job with clients because you work with so many that are neurodiverse and doing autism evaluations, assessments, where I love how you tell people like, you've always been this way. Now we have a label on it. We understand what this is for you, but it doesn't change who you've always been. And I love that, because you're right. It's like, there's nothing wrong with you. This is how you are wired. This is how you are. But it's not like they're broken. It's not like there's anything bad or wrong with them. So
yeah, I always tell people the biggest thing I get, especially when I'm doing like autism screenings on adults, typically the response is a relief response, and not so much that it gave them a diagnosis, but the relief is like, okay, now I understand why I've been thinking this way, or why I process information this way, or why my relationships have been this way my whole life. So I love that piece of it.
Oh, Darcy, you froze. No, you're back. We lost you at I love that piece of it, and then you froze. And I was like, what was she going to say? She left us on a cliffhanger.
I love that piece of it because I think it helps give people an understanding of like what they've been experiencing, so that they can then start to kind of change and shift and work through some of the things that they're concerned about. Because it's not so much, I would venture to say that every person I've done, every adult that I've done the screening on, I don't think that the majority of them go around telling people like this is what happened. I think a couple have, but I think for them it's a very personal decision and a personal experience to say, these are the things I'm going to go to start and work on. And it helps me understand like what I've been experiencing my whole life.
Yeah. Are there any diagnoses that you guys get pushback on from clients?
I would say personality disorders are probably the biggest. But I also think that that's the other thing that's significant about not using ChatGPT or TikTok to like run through a 5 to 10 thing checklist and think that that's going to give you a diagnosis. I think these are things that we have to like monitor and pay attention to carefully. Like I'm not going to see a human being 1 or 2 times and then be like, you absolutely have a personality disorder. I think that takes time and takes investment in observation. And so I think those are things that I approach really cautiously. And it's one of the ones I think I worry about, because I think people throw around personality disorders and say everybody's a narcissist or everybody's borderline. And that's just not the case. And I think people need to really be mindful of the significance of those kind of diagnoses and what it means to kind of label somebody as one of those.
Yeah. And like, what is the role that potentially trauma could be playing on symptoms, maybe overlapping?
Yeah, I agree.
Okay, I'm sorry. Maybe it's just the way my camera is set up, but Adia, you're like not in the picture.
There you are.
Yeah.
You've been on it. You just disappeared for a hot second.
You keep going. Yeah, I don't know.
It's weird because like my screen is showing me really large. Like I have like all this space in the phone.
Got it.
Oh, are there other diagnoses that you guys get pushback on? Because like I get it on depression from clients sometimes.
Mm-hmm.
I think maybe sometimes with my adolescence, that's probably one. They're like, no, I'm not.
Darcy, you might have froze again. I was like waiting, but I was like, is she thinking? Is she frozen?
Oh, no, I said, I think like when I get pushback from my teenagers about depression, I just try to talk about it in a very different way.
Yeah.
Right. And so instead of using that terminology, we just talk about symptoms and like what it means and how it presents. And then I just kind of go from there, because again, like sometimes people don't necessarily want the label or are comfortable with the label. So it's okay to talk about what they're experiencing instead.
Yeah. I also think it's helpful to talk in that sense, but also, you know, just because you might be showing up with depression doesn't mean that you have a chemical imbalance in your brain, right? Those are the people that it's like they would benefit from medication, because therapy can help alleviate symptoms, give you coping skills, give you a place to be heard, to be validated, to process all of that. But if it is a pure chemical imbalance, like, okay, maybe that's medication. But I think explaining to people, like, there can also be situational depression. There can be depression that is very normal, that we wouldn't just jump and be like, you need a psychiatrist, you need to go on medication. Like I'm thinking like when somebody has a significant death in the family or ambiguous loss, or I mean, even with like teens with like hormonal changes, it's like, okay, so we know that there's going to be depression around this time of the month, you know, like I'm thinking of like PMDD or things like that, where, you know, women can have periods and then have periods like of depression, like right before they start their cycle. And it's like, okay, maybe that's not medication, but I think giving some psycho ed on what that whole like scene could look like, because I think sometimes, at least for my clients, they hear depression and they automatically think medication. And it's like, that's not always the case. So that was a whole long spiel that I just went on about that. So I'll shut up now and let you guys talk.
Yeah, I was going to say I haven't really gotten specific pushback on like a specific diagnosis, but more so the idea of like, does this mean I have to go on medication? So that's like something I feel like I'm always having conversations about. Like, no, even if that's the psychiatrist's recommendation, you still get to decide like if that is right for you. And then we'll talk about like what's blocking that, or like what are some of the fears? What are some of the challenges? Like, is it these kind of preconceived notions about what that means if you take a medication? Is there some kind of shame piece to that in having help and having support and taking something every day? And like that's not for everybody, and it's not for every diagnosis, but for some people it can be life-changing. Or like, you know, I've heard, you know, when people come from like families or situations where that was really frowned upon or already had a huge stigma around mental health, then I feel like that comes up more.
Mm-hmm. How often do you guys suggest medication? Because that was another thing on my list, that we like make people go on medication all the time.
I wouldn't say I'm like, you should go on medication, but I will, if I'm like really seeing like signs and symptoms of something, I think I often recommend clients just go get a baseline of things done at the doctor. Or if you have curiosity about these things, like go see a psychiatrist. Or like this could be something that could really help. I don't know, like on the spectrum of like often, I'm not sure.
Typically, I like to kind of get a good sense or idea of that person and whether I think they would be, based off what I know about them, even open to the idea of medication, right? Like if I know someone is very much so against medication, however I figure that out through conversations, through things they've said, through their lifestyle, I'm probably definitely not going to jump into recommending that until I feel like it's either absolutely necessary or appropriate. I also feel like this could be a good point for us to transition into that therapy myth. That therapists do not prescribe medication. We do not register service animals, right? Like that, kind of all of those things.
FMLA, disability paperwork, custody agreements, or custody evaluations.
Yeah. And I think, and I mean, I get it, right? Like if you're not a therapist, I could see why people would think that would be what a therapist does. But yeah, we don't prescribe medication. We don't do medical leave. We don't do service animals, none of that. So that's kind of an interesting one that I think a lot of people always think is something we provide.
Yeah. And I think there are some therapists that do that, but just kind of going off on that, it's like it has to be within their scope, right? They have to have extensive training and specialize in it, different liability insurance, things like that. But like that's their area and that's their only area. So if they're doing, let's say, custody evaluations or disability, like that's probably all they're doing, not, couples and families and trauma therapy and like autism or neurodiverse evaluations or anything like that. So yes, for everybody listening, we don't do service animals, FMLA, disability, custody, none of that. Can we just have that running throughout the whole thing?
Yeah, but I will say the other piece of that is that I think it's important for clients to know that one of the things that we do is try really hard to coordinate care with other providers if our clients are seeing psychiatrists or have other outlets that they're using. And so, like, for me, that's something that's been really, really important for me is to make sure that when I have a client that's seeing a psychiatrist pretty consistently, I always try to make sure that we're checking in and checking on symptoms. And I think I've been really fortunate that most of the psychiatrists that I work with are pretty comfortable and are really good having like a 90-day check-in or every 6 months, which I think can be helpful because especially as someone who talks to a lot of kids and teenagers a lot, they're not always comfortable going into the psychiatrist's office and opening up about symptoms they're experiencing because they're not with that person often. And so when they're coming into therapy and saying, these are the things I'm experiencing, it's really helpful for us to be able to contact the psychiatrist to say, these are the things that they've been experiencing the last 60 days. Yeah. So in case they don't bring this up, I want you to have this information.
So on that, and Adia, I know you had something, so I'm just going to say something really quick and then I'll shut up and let you go. But I think...
You take your time.
So with Darcy, what you're saying, I think it's important too to like let people know, like we have to have that release of information in order to have that coordination. So I'm just saying that. So if anybody's listening, like, oh my God, like you just talked to whoever, it's like, no, we don't. Like we have a signed release of information where we can then breach confidentiality for a specific reason. So that coordination of care is really important with psychiatrists, even with like medical providers. Like if somebody has, let's say, a chronic illness or they have a big surgery coming up, like we would want to talk to them just so that we're getting more information as well. And I think it's also important where if we are ever recommending, hey, like maybe talk to a psychiatrist, or if a client brings up, I've been thinking about getting a diagnosis or going on antidepressants or anti-anxiety, we have a group of psychiatrists that we refer to because we know the good work that they do. And so when we give recommendations or referrals, it's like we've had other clients that have gone, or we've talked to them, we've consulted with them, and so we have a good idea of how they're going to be as a psychiatrist. And if we ever hear like horror stories, we take them off our referral list because we don't want to put other clients through it. Like I had that happen where a psychiatrist gave like a horrible diagnosis in the first session and I'm like, how did you get there? Like, you met with them for 15 minutes. Like, I don't understand how that happened. So like, that psychiatrist is not going to get referrals from me because of that one experience. So just wanted to piggyback on that.
And I think it's important for clients to know that, like, we're not sitting around calling each other talking about our clients behind their backs, right? So, like, if I'm going to talk to, like, one of my kiddos' psychiatrists, I'm having a conversation with them. And I'm saying, I just want to let you know, like, this is a conversation I'm going to have. Like, is there anything you want me to include in this conversation? And then I'll kind of let you know how the conversation goes. Because for me, that's really, really critical, because it's really, really important that we maintain trust with our client. So I always want them to know that those lines of communication are open.
Yeah. And I think clients do worry about that. Like, are you just telling everybody about me? And it's like, no, like, we've worked too hard to get our license to have it taken away because we've, like, breached confidentiality. Yeah. Are there other myths that you guys have that you guys want to talk about? And I can pull up my list too.
I think one that comes to mind is, like, your therapist is going to tell you exactly what you need to do and give you advice and like direction for like, this is what you need to do. This is a situation. My therapist is going to give you the answer. I see that a lot.
Yeah.
I think that is probably like the most common therapy myth, and where a lot of people come to therapy and then either are disappointed or frustrated with their therapist, frustrated with the process, because they so desperately, and I get it, like, want to feel better, want to fix their problems, don't want to be in this situation anymore. And I actually heard another therapist, I think it was online, talking about this specific thing, and she worded it really well, but she was kind of just talking about how, therapy is a long process. I have myself had clients where I'm, asking them those processing questions, right? It's a part of the treatment. And they're like, why are you asking me these questions, right? Like, why does my past matter? Why does this relationship matter? Why does my mother wound matter, right? And it's like, because I'm helping you get to the core of where we need to go, right? But I think in that process, people will get frustrated, right? Because a lot of times people just want that answer. I want that one answer. I want that one tool to be able to fix my problem or to be able to help me be more productive or whatever it is. But it's just not, it's not that simple. There's so much, to unpack and work through, and it's not going to happen in one session often.
Yeah. And piggybacking on what you just said, Lucy, it's interesting because I don't know that every discipline does that. Like, I think us as MFTs, marriage and family therapists, we are looking at this whole system that our client has been in all the way back to childhood, right? We're looking at those mother wounds, the father wounds, attachment history, different relationships, the system that the client's in now, where I don't know that every other discipline does that. So that is something that sets us apart. And it is really important to understand the client and help them process and help them make their own decisions.
I think I had a couple once, and I mean, they were completely joking, but they said at one point, they were like, we just need you to tell us if we should get divorced or not. They were like that scene in Bad Moms where a couple goes to the therapist and she's like, I don't normally do this, but you guys get divorced immediately.
Yeah.
They were joking about, like, what, can't you just do that? And I was like, yeah. I was like, that's not how this works. But I think that that's a really kind of common question as well. As, like, especially when a couple is trying to make that kind of decision. I think sometimes they're looking for the therapist to be able to say, well, I think you guys should stay together. I think you should separate. And, like, that's not a decision that we're going to make.
Right.
Right.
Oh, totally. And I've definitely, like, had that come up. And a lot of times I'll say, like, let's walk down the path of these various options. Not saying that's the decision, but let's explore it. Like, what is the path of divorce look like? What are some anticipated challenges, fears, things that might improve? I mean, yeah, I feel like to Lucy, to your point, like, people want a quick fix and, like, a quick answer, and I totally get that. And there's also that side of we aren't the experts on the client is the expert on the client, and having to respect the autonomy.
Right. And we don't know everything that's going on, right? We're not the expert on them. And so we might be thinking like this relationship is not healthy, it's super harmful, the client could do a lot better, but in reality they might not feel like they have a choice, whether it's like kids or finances or things like that. Like I have that with clients who want to leave a job, but they're stuck because they're getting paid really well. And it's like, well, I'm not going to tell you to quit your job because like you need to make a living. So we're not going to tell you to leave a relationship. We will point out maybe like red flags, like, you know, this isn't like, that isn't a healthy relationship behavior. Here's some like red flags and green flags, and hope the client can make their own decision with that.
Well, that just made me think of the other piece of a therapist giving a client a direct, this is what you need to do. And then say the client decides to do something different, and the shame that they carry from that. Because I've actually had clients have that experience before with like, you know, other therapists or psychiatrists or whatever, where they're like, you need to do this thing. They choose not to do that thing because it doesn't work because of all these other reasons, or because they decide a different path for themselves, which is fine. Like it's their life, right? And then they're like, I can't see this therapist again because I have so much shame. Like I didn't do what they said. And it's like, I feel like there's that piece of it too.
Well, think of how many times, like, if we give clients homework, which I don't give homework a ton, but I might give, like, every once in a while. And I'll have clients that are like, I didn't do the homework. Please don't fire me. And it's like, there's even shame with something like that isn't urgent. It isn't, you know, catastrophic that they didn't do it. It's more of extra tools and resources for them in between sessions. But they have that shame coming in. And I'm like, hey, you're good. Like, like you're allowed to have a life outside of therapy. I get it. Yeah. How do you guys handle just kind of going on like, do we tell clients what to do? Like if a client is in a really, maybe let's say dangerous relationship, how do you guys talk about that in a way that can tell the client that, you know, hey, this is unsafe. You know, we have some safety concerns. How do you guys talk about that?
And can I even add, and I'd like to say this, maybe it's not even like safety concerns. Maybe it's just like, they've been in this relationship for 20 years and nothing is changing, and it is very unhealthy, and it is not, maybe their significant other or partner is not willing to go to therapy, is not willing to address their part.
Isn't willing to change behaviors at all.
Because I think that's almost even like, and you guys tell me, I feel like that's almost like more tricky, because it's the safety concerns. It's like we can easily point out like the obvious, but when it's like, we've been here for 3 years, you know, like where do we go from here? I'd love to hear your guys' opinions.
I say that.
I feel
that's what I say.
Kind of what comes to my mind is like the difference between like, I don't know, when Lucy, hearing you talk about that, I think of like emotionally unsafe relationships, and still having like an honest conversation about like, let's just have an honest conversation about some of these things. And like, I'm not going to tell you what to do, but I might reflect like, these are things that you've told me. These are things that we've talked about. These are things that you've reported. These are things, you know, this is how you've told me this has affected you. You know, where do you see yourself in this relationship? What would need to change for this to look different for you? And if a client is like, I don't think there's something that could change, or I don't see my partner willing to do any of those things, then I might say like, that's something to think about. Like, that's information for you.
Yeah, and with that, it's like you can continue to stay, but let's reframe it. Let's change the expectations. Or do we look at other options?
Yeah, and I think there's a lot of it has to do with like where your relationship is with the client, how long they've been in therapy, because you're talking to somebody that you've seen a few times, that conversation is obviously going to look very differently than if somebody's been in therapy with you for quite some time. And I always tell clients, like, part of my job is to, like, put money in their bank account, because there will be days where I have to make a withdrawal where you're not going to like what I'm going to say. But I already have a little nest egg there. So, like, it's okay. So I think sometimes I just say that very plainly and say, like, we need to have a really difficult conversation. But this is coming from a place of care and concern, not a place of judgment. And then I think, you know, sometimes you just have to be very matter of fact about it and say, like, I'm concerned about your safety, or I'm concerned about your well-being. And, like, how do we get you to a place where you aren't feeling this way and we don't have these concerns?
Yeah. This might be switching gears a little bit, but there's this person on social media, and she talks about how people come to therapy because they want a mommy. Have you guys seen her? Mm-mm. And it just makes me think about that as another therapy myth, that therapy is always going to be, like, very gentle, and you're always going to be validated, and you know, your therapist is going to make you the victim and, like, help lead you. That's just not how therapy is, right? Sometimes we're going to be really direct, and you're not going to like what we have to say. And sometimes that means people don't come back to therapy if they're not ready for that. They're not ready to maybe hear some of that hard feedback. But I think it's important for people to recognize that, like, if you are choosing to go to therapy and this person is the therapist themselves, right? Sometimes I think about this, right? Like, I'm putting myself in a very uncomfortable situation by giving you hard feedback. I don't really want to have to put myself in an uncomfortable situation, right? But I'm doing it in your best interest. I could just continue to validate you and kind of stay in that place, but then
that's a waste
changes.
Of time and money.
Totally.
And it's not helpful. Like, it's not helpful to the client. And I think we do validate clients often, right? We can be very gentle and validating and affirming and things like that. And I see that a lot with clients where it's like, because we have this outside view of them where we can reflect changes that they're making, even when they're so tiny. You know, being able to say, hey, that was a step in the right direction, or look at how differently you did this today than you would have a year ago or 6 months ago or whatever. But then it's also, you know, having the hard conversations about how clients get in their own way sometimes, or they self-sabotage, or they tolerate a level of disrespect or emotional abuse, and being able to have that conversation, like Darcy said, from a caring, concerned place, not judgmental, but here's my observation. You know,
For sure.
And I will get spicy with clients sometimes, not on purpose. It just kind of, like, comes out where I'm like, oh, well, it's because of this. Like, let's have a conversation. And they're like, okay, like, let's go there. Like, you're extra spicy today. I'm like, sorry, not sorry. Like, you know what you're getting with me. You know, just is what it is.
Well, I 100%, I agree with everything you guys are saying. And Darcy, you were saying too, like, the conversation might, like, look and feel a little bit different. Depending how long you've seen this client, what the rapport looks like, like somebody that you're just starting out with, you don't know, like, what, because every client's needs are different. Like, I feel like that's a therapy myth, is that, like, one size fits all, and, like, absolutely not. Like, a therapist that might be an amazing fit for someone might not be a great fit for someone else, and that's okay. And it's also, like, therapist learning what works for that client. Like, I feel like I can think of clients right now that I know I can be really direct with you. Like, you want me to come in here and challenge you and be hard on you and say the hard questions. And I know clients too that I know I can't be quite that hard. I can't be quite that direct. I'm going to be a little bit softer with the way that I say things, or the way that I ask those questions, or I might preface the question a little bit differently. It's not like one is bad and one is good. It's just, like, different, and, like, knowing the client and, like, what works and how those things are going to land, which, Darcy, to your point, is, like, so much easier to know that if you've been working with them longer. So it's like that whole rapport piece. And I love your metaphor of the bank.
I know, I'm, like, stealing that. I also think it's different if it's, like, an individual, like an adult individual versus, like, a kid in a family, right? If we're having to give hard feedback to parents, again, gauging, like, hey, here's how you're making your kid's symptoms worse. You know, we're not just going to come out and say that. We're going to be doing a lot of, like, kind of gently guiding them to that point unless you have had that, really solid rapport with them versus like a couple, because with a couple, it's like we have to maintain neutrality and it's like keeping both partners kind of like even with us. Like, okay, I'm on both of your sides. So how do I have a hard conversation that doesn't necessarily call out one partner where then they're going to like quit therapy and never come back and hate therapy forever? And so it is like all of these different systems kind of pieces too that we have to think about when we're giving hard feedback.
Yeah. And I feel like it looks like every kind of client, like you're so right. Because couples, that's going to look different too. And I feel like that's one of the things about couples. Sometimes they come in and it's like, it's going to be this perfectly balanced, like I'm coming in because I'm ready for my therapist to validate everything that I say. And, now my partner is going to be called out. And it's like, sometimes it doesn't go like that.
Yeah.
It's like the therapist is noticing different things. And yes, there's that, of course, like neutrality and non-judgment always, but it won't always feel perfectly neutral and balanced in couples therapy. And I think that's an important conversation to have with clients in the beginning of couples therapy, and just prefacing with there might be times that it feels unbalanced, and that's part of the process. That's part of the perspective taking. And it doesn't mean I'm like jumping to this side or jumping to this side. It's just deepening. Like, let's talk about these things differently. Let's kind of question some of the perspectives.
Yeah, I always tell couples, I'm like, I'm on the side of the relationship, not individual partners. And so it is going to feel unbalanced, or it might feel like one of you is in the spotlight a little bit more, but it's all because, if we're wanting to better the relationship, like that's my client. So, but yeah. I hope this was helpful for everybody who's going to be listening to this later. I appreciate you guys taking time today. I know we have a couple more minutes. Is there any like last maybe myth we want to talk about, or feedback or guidance, or anything that you guys feel like you would want to put out there? And it's okay if there isn't too.
Immediately this comes to mind. I feel like, and we don't have to have a whole conversation about this, but I feel like a lot of movies, shows, media in general portrays therapy.
Oh, I hate those.
So wrong. And it's like, I think one thing I want to like put out into the world is that therapy isn't like you're coming in and your therapist is just going to sit there and nod at you and not say
How does that
anything.
make you feel? Like, that's not the only thing we say.
There's been that in movies, or like probably in the past, because I know there's that whole like blank slate therapist movement where it's like, I want my client to just sit in the silence always. Like, yes, there will be moments of, silence and thinking in therapy, but your therapist isn't just going to be like staring back at you blankly.
And if they are, you should get a new one.
Because I feel like you see that in movies. It's like the person comes in on the couch and the therapist is just like staring back at them, and it's like really uncomfortable. Like, therapy doesn't have to be that. Like, you don't have to come in with this like persona. You don't have to come in any specific way. Like, it's like we're both just people, and like wanting to build an environment that's supportive for you.
And I think it's also important to remember too, like, not all therapy is talk therapy, right? So like when we're talking about like, I mean, I have been in session sometimes and I can have a kid and we're doing an activity or they're doing a project and they're like, Darcy, don't talk to me, don't bother me. And I've had parents be like, this was really quiet in there. Like, should you guys talk about anything? And so I always remind people that there are other ways and there are lots of different modalities that we use to kind of get to conclusions. And sometimes that might be a kiddo working on a project and saying, leave me alone. I can't concentrate if you're having a conversation with me at the same time. But that doesn't mean that there's not really good work happening in that moment.
Yeah. I love all of that. And I hate watching therapists in shows and movies. It's like my biggest pet peeve because I get so annoyed and I'm like, I can't watch this. So I hate all of
Oh my
it.
gosh, the therapists are always awful and super unethical, and it's like painful.
I'm like, you wouldn't do that. Like, oh my gosh, it gives me like board of behavioral health anxiety because I'm like, that would be a board complaint. Like, I just get like so anxious. So,
I also feel like everyone should do this isn't necessarily a myth, but, everyone should do their research before they get a therapist. Not every therapist is the same.
Yeah.
And it's funny because in grad school, they kind of try and mold you to all be the same. And I think when you come directly out of grad school, you have a bit of insecurity of like trying to fit the mold and trying to be this person. And now I'm like, please look me up before you come into my office, so you know what kind of person I am, right?
Yeah.
So that you're not coming in and expecting something of me that I'm not going to be, right? I think our office is, you know, a female-driven business, and we're all pretty goofy, and we all have our ways of being, right? And some people, like, when they reach out to me, they're like, I want you as my therapist because, like, I've seen your TikToks, and I think you're funny, and, like, they just like my personality, and so some people reach out to Darcy because they specifically know that she specializes in neurodiversity, right? Like,
or they like the vibe, like
totally. And so do your research on a therapist, and you know, make sure you vibe, make sure you like their vibe, because that is someone that you're going to be, you know, working on some really intense stuff with. And so make sure they're someone that you could actually have a relationship with, obviously a therapeutic relationship,
but it is a relationship. I mean, it is a professional therapeutic relationship. You're right, it's somebody that you feel comfortable with, that you feel like you can relate to, that they understand you, that you feel safe with. Like, that's going to be the best predictor for success.
And I'm going to leave with this therapy myth. Oh, I don't know how I didn't bring this one up. the age of the therapist
doesn't matter,
right? Some people think that when in my graduate program, there were women who were 60, there were women who were 20, and they graduated at the same time. And we do not give therapy based off of our life experience. We give therapy based off of our education and our training, and it's all the same. And we do continued education that gives us different trainings and education, but age does not matter, and that does not mean that they're a more qualified therapist or they've been doing it longer. They could have been in the same cohort, the same program as someone who was 20 years old. So that's just another thing that I think a lot of people is a huge therapy misconception.
Well, but on that, it's about the therapist being open. Like, are they open? Are they observant? You know, are they understanding the client where they're at? And so I had a therapist that I worked with a long time ago out at Park Place. He was another colleague. And he would always say, like, I don't have to step in dog shit to know that it smells, right? And that's how he would, like, say, like, I don't have to live your experience to understand it, right? Because a lot of what we do is very much, like, intuitive, as well as, you know, intervention-based, model-based in terms of therapy models. But it's like, we don't have to go through the exact same thing to have an understanding of what it's like for that client. And even if we did go through the exact same thing, it doesn't mean that we would have the exact same experience. Just like, you know, if I work with clients who have kids, like, I'm a mom, but like, my parenting is going to be different than their parenting because we have different kids. We have different, like, structures in our home in terms of our family. And so just kind of validating, Lucy, what you said.
Yeah. And sometimes someone, you know, a therapist having that countertransference, a therapist going through something exactly that you've been through can be great and beautiful and helpful. It can also be not. Yeah. And so that's something to consider too.
Yeah.
Yeah.
The last thing I'll say, and then we'll end, because I know we got to jump into group supervision here in like 3 minutes, is also nothing is off limits in therapy. We talk about everything. Like, you're not going to say something to us that's going to scare us. Like, we've heard it all. And so I feel like clients come in and are like, can I talk about sex? And I'm like, you can talk about whatever you want. Like, nothing's going to scare us. So that would be one other thing too.
Absolutely.
Yeah. Oh, Lucy, why are you laughing?
I have this one client, if she watches this, she'll crack up, but she's gotten on the floor before and just shown me sex positions, and she's so funny.
Clothed, everybody. Like, she's clothed. Not like acting, clothed. She's not being sexual.
But it's so great. And once you do, you know, like that client I'm talking about, once you have those clients that you just build such a good relationship with, it's such a beautiful process. Yeah. And I think it's such a helpful thing to have, you know, a good therapist that you have a good rapport with and a good relationship with.
Well, yeah, because then you can be vulnerable and you can do all your healing.
Yeah.
I know. I appreciate you guys. Thank you guys for doing this today.